How fertility changes after age 30. Hello, I'm Dr. Aruna Muralidhar, a consultant obstetrician and gynecologist at Cloudnine Hospital, Jayanagar. Many women in their 30s begin to think about how age might influence fertility. In this section, we will discuss how fertility changes after 30, factors that affect conception, and the ways to support your reproductive health during this stage of life. Fertility is one of the most common concerns for women in their 30s. And it is completely normal to wonder how age might affect your chances of becoming pregnant. Let us start by understanding how fertility works and how it changes naturally over time. Every woman is born with all the eggs she will ever have, around 1 to 2 million at birth. These eggs are stored in the ovaries and their number slowly decreases over time. By puberty, there are about 3 lakh eggs remaining. And this number continues to decline as you age. By your early 30s, the decline is still gradual, but around 35, the egg quality and the quantity starts declining rapidly. In your 20s, your chances of getting pregnant naturally each month are about 25 to 30%. By your early 30s, this decreases slightly to around 15 to 20%. And as you move into your mid to late 30s, your chances of conceiving each month drop to around 10 to 15%. And this change happens for 2 main reasons. Of course, the number of eggs and their quality. As you age, the remaining eggs may not work as well as they did in your younger years. Some eggs may have changes in their chromosomes, which may make it harder to conceive or increase the risk of miscarriage even. This is a natural part of aging, and it happens to all women. However, it does not mean you cannot have a healthy pregnancy. Many women in their 30s conceive naturally and deliver healthy babies. It is also worth noting that fertility is influenced by more than just age. Conditions such as fibroids, endometriosis, polycystic ovarian syndrome can make conception more challenging in these years. These conditions become more common as women age, but are treatable with the right medical care. If you're trying to conceive and it is taking longer than expected, it is important to seek support. In general, if you're under 35, doctors recommend trying for a year before seeking help. If you're 35 or older, you might want to speak to an obstetrician gynecologist after about 6 months. Your doctor can assess your fertility using tests like ovarian reserve tests, which measure hormones such as AMH, or the anti-Mullerian hormone, or FSH, which is follicle stimulating hormone, and provide guidance on the next steps. There are many options available to support fertility. Lifestyle changes such as maintaining a healthy weight, eating a balanced diet, staying active can improve your chances of conception. Medications like ovulation-inducing drugs can help in some cases, while assisted reproductive techniques such as intrauterine insemination or in vitro fertilization, that is IVF, may be options for others. IVF has come a long way and is now common and an effective option for women in their 30s. If you're not ready to conceive but want to preserve your fertility, egg freezing is an option to consider. This involves collecting and freezing eggs while they're still of good quality, giving you the flexibility to conceive later in life. It is also important to consider male fertility, which can decline with age, though typically less dramatically than female fertility. Lifestyle factors, health conditions, age-related changes can affect male fertility as well. So it is helpful for both partners to address any concerns together. Finally, remember that everyone's fertility journey is unique. Some women conceive quickly while others take more time. Advances in medical care, fertility treatments mean there are more options than ever to help you achieve your dream of parenthood. Support is always available.